Doctors, what is your most WTF moment while treating a patient? So, my mom is a nurse and has seen some pretty messed up things. The one story that sticks in my mind involved an elderly man who came into the hospital 3 times a week to have a growth on his face washed and redressed. The growth had slowly taken over the left-hand side of his face, so much so that his left eye, his only working eye, had closed over. He was effectively blind. This meant that his wife, whom he had been looking after for years due to her frailty, was now tasked with looking after him instead. Furthermore, this bloke was old enough that the hospital didn't want to operate on him. So the hospital visit stopped. He could no longer get there, so instead a nurse would visit him 3 times a week. Now, this growth was unsightly, wept constantly, and smelled bad. Really bad. The whole house stank of it. The nurses said it smelled like death and thought he was going to die any day. Well, during one of these visits by my mom, she was cleaning his face over the sink and noticed a flap of loose skin. She went to clean it with the sponge and squelch! The growth fell off into the sink and it was crawling with bugs. The sink was now filled with dead flesh and bugs and the smell. Oh goodness, the smell. Turns out a fly had laid some eggs on it at some point, and they'd hatched and started eating all the dead flesh in the growth until it fell off. And the man? He was fine. There was new pink skin where the growth had been, and he could see again out of his left eye. Gave him a new lease on life. So, heartwarming story? Yes. Most disturbing my mom has ever told me? Hell yes. Next story. This was in med school, dermatology rotation. I got to see my own patient, so I asked what the problem was, and he told me he thought his genital warts were back, and I asked why. He didn't say a word but turned around, dropped his pants, spread his butt cheeks, and showed me a cluster of genital warts around his anus, at least 10 centimeters in diameter. Even when he stood up straight, it was just sticking out of his buttocks. I put up my most professional voice to say, yes, I think you're right. And the man thought this was hilarious. I'm not sure if I've not seen more surprising things after this or have just gotten used to them. Next story. Paramedic here, while working in the ER one night, we had a guy come in complaining of groin pain. So we bring him back, and it turns out he has a master lock, the kind with the spinning dial that you use to secure your locker at school, locked around his wiener. Essentially, blood flow could go in but could not flow back out, so things were hugely swollen. He had panicked after he realized, and he could not remember the code, dealing with a real genius here, and he took a screwdriver to the dial and snapped it off. So we consulted with urology, and the urologist wanted to take him to surgery, cut his ween lengthwise, slide the top out, then the bottom, and then suture it back on. Needless to say that the patient wasn't thrilled with option A, so option B was for the big-ass nurse, we'll call him Tom, to go in with bolt cutters and cut it off. And option B was selected. Curtain closes, Tom gives a 1, 2, 3, a loud scream at 3, a pop noise, and then Tom exits with a broken lock, and the man was sent to the floor to recover. That's just one of so many stories, but I always tell that one. Okay, guys, look, so I know that women got their own down bad moments, okay, but I'm talking to the guys specifically here. How down bad do you have to be to put it in a lock? Like a bike lock, like a locker lock. No! And you forgot the combo? You didn't want to write it down, put it in the notes app? I have never been this down bad in my life, and I pray that I never, ever will. Just, let me stop before I just keep going. Anyway, next story. So, I am a surgery resident. I once helped operate on a man whose face was chewed off by a bear. I had to find little scraps of skin at the edges of the hole in the middle of his face and try to decide where they went to try and make the damage smaller. I also saw a patient come close to the emergency department with a Barbie in their rectum. He apparently puts the arms up and legs down like in a diving position, rubber bands the arms together, then places it in his rectum for a time. When he wants it out, he takes laxatives, but only this time it got stuck. The kicker, when we removed it, he asked for it back. Next story. There used to be a well-known patient that would present to the emergency department with frequent urinary tract infections. Now, UTIs are much less common in men than in women and don't sporadically occur that often. This gentleman was a male stripper, and his part trick would be what he called a ruby shower. In essence, he would empty his bladder and replace its contents via a catheter with red wine. He would then empty his bladder during his performances. Unfortunately, fate caught up with him and one infection became too severe and he did not survive. Next story. Surgical registrar here. I was working in a smallish hospital in a rural town in Australia, and we were asked by the medical team to see a patient that had been admitted under their care by the emergency department overnight. Happens quite often in that hospital, with a CT demonstrating a very distended bladder. They apparently had trouble with a catheter, so they called me to have a look. With much hesitation, I went up to see her on the ward. So I managed to put the catheter in with a lot of trouble. This lady was fecally incontinent. A little bit of urine drains out, and I just kept thinking, something's not right. I go back and look at the CT scan, and the IDC placed in the emergency department looks like it's appropriately positioned, subsequently pulled out. Behind it was one big effer of a uterus, absolutely full of what appeared to be a fluid density. The report, it read along these lines, and I crap you not, it said as follows: Conclusion, there is a very distended bladder. The catheter balloon is situated in the prostatic urethra. Moderate to severe hydronephrosis is noted. And, well, long story short, I spoke to the consultant. We get her to the theater, and with great difficulty, we manage to dissect our way around this huge uterus, and we call the O&G guys to come and help get it out. Unfortunately, during this process, the uterus bursts, and there's a boatload of pus that just streams out. It smells so damn horrible. There are people gagging around us at this yellow-green sulfuric-smelling goo. The scrub nurse can no longer take it and vomits in her mask. The consultant is looking at me like, F you for bringing this to theater. And we finish this case, and I am so glad. I get home and I keep thinking I can still smell this awful thing. I have another hour-long shower, and all night I can still smell this thing. Morning comes, I can't have breakfast because I can still smell it. I get to the hospital and everyone is wearing masks. Apparently the smell was so horrible and the extraction in our theater so outdated that it had somehow pumped the smell into the vents around the hospital. All night, small amounts were leaking out into the atmosphere, causing this horrendous smell. Silver lining, though, the lady lived for another 3 years. The TLDR is I operated on a lady with a huge uterus full of pus, and consultant hated me for the rest of the year. Also, to all the people pointing out that the women don't have prostatic urethras, I'm well aware. That was the whole point. The radiologist was very embarrassed and apologetic when I called him to amend the report. Next story. So, the birth of our second child, my wife and I decided to go with the home birth option. Long story short, she was in full labor, dilated, and starting to push, but her waters hadn't broken. The midwife who was there said it was no problem. So my wife is lying on the ground, and I move into position to catch the baby. She starts to push, and her waters burst. Except instead of clear fluid, I'm now being liberally saturated in bright green fluid. It turned out my son had pooed during the labor, and this was mixed with the amniotic fluid. So my eyes are the size of dinner plates. This liquid is pooling around my knees in something that resembles a scene from the original miniseries of V, and I am not entirely sure what is going to be birthed, human or reptile. Luckily, the rest of the birth went fine, and my son arrived into the world less than a minute later, and I'm saving this story for his 21st. Okay, small update because I'm seeing lots of comments about the pros and cons of home birthing here. And hey, that's why I'm on here, to get others' point of view. So I thought I would provide a little background on why we opted to do it this way. You see, prior to us having kids, my wife had gestational trophoblastic disease, aka cancer, and spent a lot of time in hospital getting chemo to treat tumors that had spread into her lungs and brain. Chemo to the brain via spinal taps are not cool, and at the worst of it, she probably would have only had 6 months. She had the highest tumor marker levels they had seen in a GTD patient to live, but luckily GTD responds very well to chemo, and the oncologists here in the public health system are outstanding. So put simply, hospital was not a happy place for my wife. And we discussed having a home birth for our first, and while my wife was keen, I wasn't, since it was our first. So our first child was born without drama and hospital, and we were back home within 8 hours. Our choice, wife and baby didn't get any sleep on the ward, and we were all much happier. Then our midwives, there are always 2 midwives and we had the same for both, had 20 plus years experience and were happy to deliver at either home or hospital. We live close to the hospital and the ambulance dispatch is 500 meters down the road, so help wasn't too far away. Also, the midwife wasn't overly concerned by what had happened and seemed to have everything well in hand. And yes, we accepted that there was some slight risk involved, but we also knew that the more relaxed and comfortable my wife felt, the less stress there would be on the baby and also on her. And if we were to have another, would we do home birth again? I'm sure my wife would be keen. I'm more 50-50, so it's a tough call. Next story. Both my parents are doctors. Nothing seems to have really shocked them except for patients brought into the ER who were in motorcycle accidents. They wouldn't go into detail, but briefly said that if you're not wearing protective clothing and you get dragged across the road, it can do horrific things to your skin. And more specifically, it can do absolutely horrific things to men's nether regions. As in, what is that? What goes where? What did that used to be? And what's even worse than your chicken and testes being ripped off or ripped in half is that they use what are effectively metal scours on the wounds to get the gravel out. I'm not even a boy and that makes me wince. Next story. I was working as a scribe when we went to see an 8-year-old girl that had a fever. Nothing too unremarkable until we started the physical exam. We examined her head, normal. We examined her upper extremities, normal. Then we pulled up the blanket to examine the lower extremities. Her feet were the size of an infant's. You should have seen the look on the doctor's face when he was trying to figure out how the girl's feet got so small. The mother looked up at the doctor, saw the look of confusion on his face and said, "Those aren't her feet." And she pulled up the blanket a little further, revealing a pair of perfectly healthy feet, nestled next to the feet of a doll that she put under the blanket. We saw the doll's feet and thought they were the girl's. And for those wondering, by the way, she had the flu and she turned out to be fine. Next story. So, my dad is a nurse and I have asked him this question before, and most of the stories are about people who come in with deodorant cans up their butts and try to claim that they were climbing in a window and fell on the can or something. But there is one story which he has told me which really stands out. When my dad was in his 20s, he worked in the emergency department of a hospital. One day, this morbidly obese lady comes in complaining of abdominal pain, and they start to look her over. Everything was going fine until they decided to look in the folds of her gigantic stomach. When they smelt this horrible smell, they found a decomposed chicken wing covered in bugs which had started eating at a part of her skin. Yummy. Next story. Well, I'm not a doctor yet, but here is a story from one of my professors. This was in rural Alabama. So this middle-aged couple had presented to the ER after they had been drinking for almost the entirety of the evening and got into a heated argument. Things got heated and the woman eventually fell off the porch of their trailer into the shrubs a few feet below. The husband, in his drunken state, suddenly dropped the argument and came to his wife's aid. She didn't suffer anything too serious, just a couple of scratches here and there, except for what the man said looked like a piece of glass or pipe or something that became lodged in the woman's arm when she hit the ground. Well, he decided not to come to the hospital because he could remove this object himself. He got his largest pair of pliers and gripped onto this glass pipe-looking thing lodged into this helpless woman's arm. He clamped down and pulled and pulled. He cranked and cranked, trying to remove this object, and it wouldn't budge. After his masculinity was defeated and the alcohol wore off, both of them decided to sensibly finally come to the ER. Upon arriving to the ER, the doctor immediately realized this poor woman had a compound fracture of her humerus, and this pipe or piece of glass thing was her bone sticking through her skin that her husband was trying to pry out with a pair of pliers. True story. Next story. So I recently spent some time working in the operating department, and one day we had a giant inguinal hernia. At this point of my experience in hospital, I thought nothing could surprise me. Dear Lord, was I wrong. Now, the patient had mental health issues and we got him on the table, knocked out with anesthetics, and pulled off his gown to take a look. His scrotum, it just looked insane. We did an open surgery through his abdomen and spent hours pulling his intestines out of his ball sack. Basically, the guy's abdominal wall broke through and allowed his intestines to slowly fill up his scrotum, but this had been going on for years before he got it checked. Next story. So, story from one of my friends who worked as a paramedic in Hamburg for some time. Mind you, this is disgusting. They were called to an unconscious person, drug addict, who was slumped down on a park bench close to the train station, where back in the days the most drug addicts would hang around. They approached the guy and tried to wake him up and checked his vital signs, etc., then put him on the ground. He had no shoes on but only wrapped up his legs in plastic bags. And if you've ever been around hardcore drug addicts, you know most of them don't smell too good. After a while, they just give up on personal hygiene, which incidentally is actually more dangerous than the drug itself since they tend to not treat their scabs, etc. So this guy reeked to high heaven, and once they proceeded to check his plastic bag shoes, they saw why. His legs up to his knees were completely black and full of bugs. He had an infection in both legs due to shooting up heroin and never treated them. Very much like the picture of the homeless guy, which is circulating the internet. Not gonna post that here though. But my friend said that once they lifted the plastic bags up a little, which were melted into his decaying flesh, little mountains of bugs would fill around his feet. Hands down, one of the most disgusting things he has ever seen. Next story. My dad is a doctor, an internal medicine physician, if that means anything to anyone, and he told me this story once of when a young man, late teens, came into the hospital with a question about a condition he was having. He said his pubic region was itchy and uncomfortable, so my dad asked him to remove his pants so he could try to identify the problem. Now, since the guy was African American, my dad had quite the WTF reaction when the man pulled down his pants and his pubic hair was white. It turns out the guy had gotten crabs from his lover, and the little bugs had laid microscopic eggs in his pubic hair, making it look white. The mental image still gives me the chills. Next story. Imaging tech here. So I basically look at black and white images of people's innards. And once I had a guy and it looked like his abdomen was filled with fluid, but it looked very odd. Then I realized the fluid was moving. This guy had the biggest aortic aneurysm I've ever seen. So big I couldn't measure it on my own machine. So he got sent off to the hospital. I was in outpatient services that day, and I don't know what happened to him. Then I also had a woman with so many holes in her heart, in the muscle between the heart chambers, that it was like Swiss cheese. And then finally, another time I was in a prison scanning a convict. He'd been shot and all of his abdominal muscles were removed. He wore a Velcro girdle to keep his stomach in place, so I put my scanner down on his abdomen and I had to figure out what organs he was missing because he had some removed from after being shot, but he had no clue. I think he was missing a kidney, the gallbladder, part of the liver, and like half of his pancreas. Next story. I interned in a city that gets very cold in the winter. Homeless people who were having a tough time surviving outdoors would come to the ED to get admitted, even if just overnight. They'd get a warm bed, a few hot meals, and a cleanup. This one fellow, though, was in really rough shape, couldn't walk. The poor nurses did most of the cleanup, delousing, sponge bath, dressing the open sores. My job was to do the physical exam, including the mandatory rectal. Literally had to lift that scrawny flap of a butt cheek and pick the encrusted dirt, feces, matted hair away from the rectum to expose the anus. Thankfully, I only had to turn 180 degrees to reach the sink that I dry heaved into, but before this fellow could be discharged, he needs a podiatry consult. His black gnarled feet have thick yellow big toenails that have grown in a circle and are now piercing the bottom of the toe, which is the reason he can't walk. Podiatrist intern comes in, starts a foot soak, and prepares to tackle those nails with something that can only be described as modified tin snips. Now, you know how some people have that habit of opening their mouth when concentrating really hard? Yep, he clipped that nasty nail and it flipped right into his mouth. We shared the sink. Next story. I'm not a doctor, but a couple of years ago I was talking to my dentist. She was complimenting me on my sparkly white teeth and healthy gums. I mentioned something along the lines of, I could never be a dentist. I couldn't deal with those people who have bad breath or rotting teeth. Then I made the mistake of asking what the worst case was for her. You see, she told me about a time that a woman came in with pretty much all of her teeth completely rotten and an abscess on the back of her mouth. The dentist apparently started working on the back of the mouth and popped the thing. She described that smell as of that of a dead animal. Apparently, the smell was so bad that it permeated the thin mouth cover and the abscess had popped with such force that some of the pus landed on her shirt. I think of that story every time someone tells me I should go do interpreting at hospitals. Next story. So, I'm a bit late to the party, but here's my contribution. I have some nasty pus stories, but I think the top post wins hands down in that category, so here's something a bit different. Now, just a couple of months ago, actually, a woman, about 35 years old, comes in for a pap smear. Okay, no problem. Put the speculum in and maneuver it around a little bit to find the cervix, and I see something dark brown in the right lateral fornix. My first thought was, oh crap, cancer! You see, when I was an intern, I had a patient on whom I found very dark, friable tissue on the posterior wall of the upper vagina, which eventually turned out to be rectal cancer that had spread into the vaginal wall and was quite advanced. You know, one of those patients, you kind of never forget. Anyway, I try and gently scrape at this dark brown area to get a feel of what it was when the smell hit me. Imagine if death itself died and rotted for a few weeks. That is what it would smell like. My medical assistant scooted away to the edge of the room. Poor thing couldn't leave the room as she was my chaperone. I stopped breathing through my nose and started to breathe only a couple of times a minute from my mouth, of course turning my head away from the source of the smell to take a breath. Anyway, maneuvering the speculum a bit more and scraping a bit at the brown area, some more revealed an answer to the mystery. It was a cylindrical thick wad of something, an old tampon. The patient had no idea it was there, and her period ended over a week ago. So this thing had been there for over a week, and the lady was walking around living life as usual. Thankfully, she did not get TSS, toxic shock syndrome. Retrieval of the tampon was relatively uneventful, and the lady was sent home with advice on being more careful with remembering to take out tampons, or perhaps consider switching to pads instead. Next story. Paramedic here. Back when I was a rookie, we ran a call to assist the police with an injured person. Got on scene to 5 to 6 cops and a large naked man in cuffs sitting on the curb in the middle of February in the mid-Atlantic region. Checked the guy out while talking to the cops, and apparently he had decided to smoke some PCP and the cops ended up having to tase him. The part of the story you've been waiting for, though: one taser barb in the umbilicus and the other in the head of his wiener. Next story. Doctor here. When I was working in the ER one evening, I had my worst experience ever. I was called to one of the examination rooms that are designated for infectious patients. This is already a bad sign, as it usually involves some sort of abscess that needs to be drained. However, this time, it was far worse. I was told by the nurse that it involved a man who had bilateral venous ulcers on his legs, and that they were now infected. I looked through his journal and saw that he last saw a doctor about 10 months earlier, and there was no note of any checkups after, not by a nurse or a GP. Therefore, I asked my nurse when someone last took a look at his legs, and she says, "Not since his last journal entry." Then I ask when was the last time he changed his dressings on the legs, and she says, "He hasn't." Now, some background info on the patient. Old man who lived by himself in his trailer that was parked in the middle of the forest. He had no running water. He was a bit of a drinker and had a general "I don't give an F" mentality. Awesome. Suited up and went into the room. The room, it smelled like an odd combination of stale beer, mold, and disease. Certain infections smell different, and this one was very pungent, almost sulfuric. I introduced myself to the patient, who didn't understand what the F he was doing there. All he wanted was some antibiotics for a flu. And then he was sent here. "Why the F do you want to look at my legs for? They were already taken care of last year." Oh, great. So we started unfolding the dressing. They were crusty and crackled as we unwrapped the first leg. As we got deeper, it changed color to some sickly yellow, and the stench became worse and worse. One of my nurses left the room to throw up. Then I saw it. Very small, but inside a fold there was a little bug who squirmed. Ugh, when we finally got to the wound, we saw all the little bugs feasting on this man. There must have been 50 of them. The stench was absurd. I was focusing a lot to breathe through my mouth, but then it felt like I could taste it, which made it even worse. My nurse came back and promptly went out again. I unwrapped his other leg, and same story there, but the infection was much deeper, and I could see a few tendons on the base of the ulcer. Absolutely delicious. So we had to clean off the bugs and placed them in a bowl, but they were squirming and went on the floor and crawled all over the place. I had to watch my feet so I didn't step on them. After that, we took the patient to hose him down to at least try to get rid of some of the smell, then booked to the OR for debridement and a fresh vacuum dressing. Discharged a few days later with strict instructions and booked him in to return for redressings and checkups. Then, we never heard from him again. TLDR is bugs. Lots of bugs. Next story. Med student here. I've seen some pretty nasty stuff, but the best stories come courtesy of my parents, who are both doctors. So early in my mom's training, an old man presented to the ED. On examination, his feet were incredibly gangrenous. My mom sets out to manage his various issues and decides that soaking the man's rotten feet before dressing them is the best course of action. So she gets a basin of warm water and leaves them to soak while she goes about her other work as a junior doctor. She returns about half an hour later to find 10 little piggies floating around in the basin. Then my dad's story occurred while we were living in Scotland in the early 90s. It was a particularly sunny day by Scottish standards, and one of the rare days you might be able to get a tan. The Scots, though, they are not known for their ability to tan, and the typical Celtic Scots less so, wiry red hair and pale white skin. However, one such Celtic man was rather overzealous and decided he would really go for it on this day in question. He cracked out several sheets of tinfoil and basted himself in cooking oil. Needless to say, he pitched up to the ED a few hours later. Third-degree burns all over his body. Next story. Okay, token, not a doctor, but I am a nurse and I have a story. I was working in the emergency department one afternoon, and we had an elderly lady just calling out, help me," repeatedly all afternoon. She was brought in by her nursing home for agitation, which is normally code for they can't handle them anymore. So the PT was placed with a carer assistant to try and calm her down and make sure she didn't wander around the ward. The carer was helping to feed the PT, and I walked past when suddenly the lady just breathed her liquid diet in and collapsed backwards. I, of course, instantly pushed the med emergency button, and everyone comes running from all over. We assess her airway, and it's deemed clear but not self-supporting. No food in there, which was strange. She wasn't breathing and no heartbeat was present, so one of the male nurses starts compressing on her chest, while another nurse tries to insert an airway. As he compressed on her chest, a literal fountain of murky green goo spurted from her mouth, all over the walls, ceiling, medical staff, literally everywhere. And of course, we're all like, what the hell is this crap? And the poor male nurse had to keep compressing the chest while the other nurse kept trying to suction the patient's airway to clear it enough to insert an airway. After 5 or 6 minutes minutes, the nurse finally gets the airway in after suctioning over 6 liters of this goo, and after some defib, the doctor declared the patient dead. The bay and the surrounding, say, 5 or 6 meters was just drenched in this slimy, murky, brown-green mess. It was absolutely breathtakingly disgusting. Eventually, though, we found out the poor old lady had a massive bowel obstruction, had a cardiac arrest while eating, and the goo was days and days of liquid fecal matter. Safe to say I scrubbed myself raw in the shower that night. Next story. Not me, but a friend. He was delivering a baby of a frequent drug user, and after the baby was delivered, all that was left was the lovely afterbirth. Now, these are not pleasant things in the first place, but with the constant infections and wounds this woman had, she somehow managed to develop a cyst or something pus-filled on the wall of the womb, which had ruptured during childbirth. What came out of that woman, he said, was the most vile thing a woman could birth, a mixture of afterbirth, rotten flesh, and uterus lining, and a decent amount of creamy pus. Yellow, brown, and red. The baby was fine, though. Quite healthy, too. So, how's everyone's stomach feeling so far? You guys feeling good? I took a pause while recording to go make lunch. Then I'm gonna go eat lunch. And I'm gonna try my hardest not to think about this video while I'm eating lunch because, oh my god. Oh, hell no. Next story. So, I just recently caught up with an old friend of mine who is now an OR nurse, and she told me this gem. She was preparing a morbidly obese woman for surgery, scrubbing her down and cleaning the areas up underneath fat rolls that haven't seen the light of day in God knows how many years. When she picked up one particularly hefty roll around the side of this lady near the lower back, she stopped suddenly. Is that a bone? She mustered her courage and continued to investigate. A moment later, she uncovered the skeleton of a small kitten. The bones were fused with the still rotting flesh of the sad little creature. Holding back tears and vomit, she walked around to face the large woman and said, "Ma'am, I don't want to alarm you, but I've just found the remains of a small cat in one of your fat rolls." And the lady's response, seemingly unfazed, "Oh, I've been looking for him." Apparently, people this huge develop rather thick calluses in their fat rolls from all the friction. This cat could have been clawing for their life in there, and she might not have felt a thing. Poor little guy died trying to claw his way out of hell. Next story. I've been a doctor for over 20 plus years, and nothing has made me cringe, laugh, or display shock until one patient. This shy, obese young man walks in, heads down, and walks into my room. I chat up with him to see what's wrong, and the guy dropped his trousers, revealing the tiniest wang I had ever seen. It wasn't bigger than a AAA battery, and I don't know why, but I burst into uncontrollable hysteria. Tears streaming from my eyes. I pretend to fake cry, but it's obvious I was laughing. After a minute or so, I look back at him, take a deep breath, and I say, "I'm sorry. I'm really sorry. I don't know what came over me. I promise it won't happen again. Now, what seems to be the problem, sir?" And the guy starts sobbing and says, "It's swollen." So, really quick, I don't know if you guys have heard this before, but I heard this story before on Facebook in 2012. So I don't know where this story comes from. Maybe this is the progenitor, maybe this is the original person, but when I heard it, it was about a nurse and heard like the swollen analogy. I don't know. Hopefully nobody's wiener's that small. Anyway, next story. So a good friend of mine is a nurse and by nature has the best stories. She was working the med-surg floor in the hospital and had a female patient who was so morbidly obese that she needed a service animal to help her. No, not a dog, as most people would think, but a monkey. This lady had a damn service monkey. It would go get her glasses for her, grab the remote for the TV, all kinds of things. Odd, but not really a WTF moment, until she walked into the room to take the woman's vitals and finds her breastfeeding the monkey. Next story. ER nurse here. We brought a code trauma off the helicopter, a lady who was a passenger in a really bad wreck. Her husband was driving and was dead at the scene. Once we got her stable, though, the OR staff came to take her to surgery. I gathered up the clothes that we had cut off of her and grabbed her purse that EMTs had removed from the car. There was a lot of blood on it, so I thought I should just grab her wallet instead. Well, I reached in and grabbed what I thought was her wallet, pulled it out, and it had hair. It was a chunk of her husband's scalp. Next story. This is a nod to my grandfather, who was a doctor. Way back when, he was called out to a coal mine where a miner had been crushed by a coal cart. Apparently, there wasn't much left of the poor guy, but as my grandfather was first on the scene as such, he noticed that the cart safety lever wasn't on. Well, this is important because if the deceased miner was found to have been operating the cart without the lever, the company wasn't obligated to pay his widow a penny. Needless to say, he flicked the lever into position and made a tragedy easier to bear on the the remaining family. Next story. As a medical student in a urology office, we had a young, healthy male come in with problems urinating. He said he had hesitancy and a decreased stream, pretty odd for a young male. So the doctor went through all the standard questions and it was a benign physical exam. Did a prostate exam and nothing was out of the ordinary there either. So after a couple of visits, a cystoscopy was done, which is a little black tube with a camera on the end is shoved up your pee hole to look at your bladder. Well, this guy had strictures all over the place. Extremely odd. So more questions like, have you ever had a catheter? And nonchalantly he goes, oh yeah, hundreds of times. For what? Well, when my partner and I host parties, I take a catheter and I drain my bladder. And we both thought that was strange and thought maybe he doesn't want to miss any of the party by having to pee. We were clueless. So then he states, and then I fill my bladder up with red or white wine. Okay, it doesn't work like that, but chugging sure, but not the bladder. So here comes the kicker. This guy would go around and pee in people's mouths to give them a drink of wine. It was a big gay orgy to find out. Okay guys, I know you haven't forgotten already, but we heard about this earlier in the video. Is this a common thing? I know people like their red wine, and you know, that's a really interesting and kinky and freaky party trick. But is this common? Because that is a problem. I'm sure we could find like slightly less but still kinky ways to pour wine into people's mouths, but oh my god, no! Twice? Are you kidding me? I mean, we get so many pus stories, so maybe 2 wine stories isn't that crazy? I don't know. Anyway, next story. So, on my first weeks in trauma ER, 4th year of med school, we had an 11-year-old girl come in who was literally dumped out of a car in front of a hospital with one side of her body completely mutilated. What remained of her limbs was just hanging like a huge chunk of meat, and the rest of her body was burned all over, and there was so much blood. Maybe it's because I panicked a little, but I don't think I've ever seen so much blood in my life. We later found out that someone in her family, father or cousin, not sure, was a known criminal who had just gotten out of jail for blowing up ATMs with homemade explosives. They claimed she found a stash that they had hidden, but we really believe she was helping them pack it. Either way, it was the ugliest, saddest thing I've ever seen. Next story. As an imaging tech, we once had a patient who was close to 400 pounds, who was fairly well bedbound. To assist with hygiene, the patient had a rectal tube that drained their feces away. But this had fallen out probably days earlier, and as a result, there was a pool of horrible substances trapped beneath her, brewing. This was discovered when we rolled her to position for x-rays. The smell cleared the room and lingered there for hours. While people went and showered and changed their clothes from the pervasive creeping miasma, that was the worst thing I have ever smelled in 15 years working in hospitals. Next story. Med student here, I've got a few. I watched an angry patient pull out her PICC and her GJ tube in front of a bunch of people and then throw a knife at one of the nurses. One time, I once scrubbed in on a middle-of-the-night debridement of a necrotic breast flap. A 30-year-old woman had a reconstruction after a mastectomy by using a flap of tissue from her abdomen, and her whole breast was black and shiny and shrunken and hard. And of course, it stank of rotting flesh. The saddest part is, though, that this was her 3rd flap. Her last 2 had failed as well. Another time, I also got to fly solo on a middle-of-the-night draining of a breast abscess. As soon as I sliced it open with the scalpel, tons of pus started pouring out, and some of it landed on my shoes. The worst part, though, was after I was done, she was about a B cup, and the abscess had taken up most of her breast. So there was almost no breast left when I was done with her. She was in her early 20s, and also, we had trouble keeping her under. And as I was cutting into her breast, she suddenly flung her arm up and hit me square in the face. I wasn't expecting that. Another time, I scrubbed in on a severe case of mesenteric ischemia. Necrotic bowel is probably the single worst smell in existence, and oh my god, there was so much of it. And yes, it exploded and feces spilled everywhere. There was another middle-of-the-night case, debridement of a necrotizing pneumonia from the ICU. I have never seen third spacing this bad, not even in photos. The man's testicles were larger than grapefruits. Then, first case I ever scrubbed in on was an esophageal cancer, and I watched a surgeon stick her entire arm through the abdomen and up behind the heart and saw her fingers come out at the top. That was awesome. Then another time, an exploratory laparotomy on a girl to find out why she wasn't doing well 2 days after her surgery. Well, we opened her up and we found out why. There was an artery that had been spurting blood into her abdomen for the past 48 hours. I never knew an abdomen could contain so much blood. It ended up filling several buckets. Then a 700-pound man with the most horrific pressure ulcers I have ever seen all down his back and butt and legs. And his legs, I don't know if it was odd fat deposits or blockage of lymph nodes, but his legs didn't even look like legs. Imagine a humongous leg with what looks like a tumor the size of that leg attached all along it. The craziest thing is that apparently this man had been able to walk and even go to work before he came into the hospital. God knows how. Then a woman who came in with a giant tumor on the side of her skull. She had had it for about a year and only just decided to get it looked at. She was totally nonchalant about it, and it was just so effing eerie. Another time, I once did a pelvic exam on a pregnant woman only to find her dead fetus in her vagina. And then I had to go biopsy the fetus by myself. Helped a woman who had been a victim of female genital cutting, complete with infibulation, and then she gives vaginal birth. Another time saw a man who looked completely normal from the outside, but his CT showed that almost his entire abdominal cavity had been taken over by the most massive soft tissue sarcoma I have ever seen. It was twisting around all his organs and cutting off the blood supply to them. He was literally being crushed from the inside by this tumor, and there was nothing we could do about it. He probably only had a few months left. I just couldn't get over the fact that he looked completely normal from the outside. Like, I couldn't wrap my head around that the scans were of his body. Then I saw a young teen with a sarcoma that had invaded her spinal column and was knocking off nerve roots one by one as it progressed down along her spinal cord. These are probably the most horrific scans I have ever seen or will ever see in my life. Her entire body was riddled with mets. There were mets in places I didn't even know could grow mets. Even the radiologist was like, holy effing crap. Then this one isn't gross, but just sort of a Twilight Zone moment. I was explaining to a woman that we needed to do an MRI, and she calmly informed me that she couldn't get an MRI because she had a mental tracking device in her body that had been implanted 10 years previously when she was abducted by aliens. Previous to that, I had been speaking with her for an hour, and she had given every indication of being a perfectly sane and normal person with intact mental facilities. I just replied, without skipping a beat, that we could safely CT her instead. Then another, not gross but effed up moment nonetheless, a patient admitted to me that he had repeatedly essayed his own daughter. I think I deserved some kind of Oscar for keeping my face and tone of voice completely neutral. Then the second worst thing I have ever seen in my life. The aftermath of emergency surgery for acute necrotizing pancreatitis. The pancreatic enzymes had spilled out and rapidly started digesting all the abdominal organs. They had to go in and remove so much bowel and pieces of other organs that they had become necrotic. They also had to remove most of the skin and soft tissue covering his abdomen and left the wound open to slowly heal. So I looked underneath his dressing, and there was this giant rectangle of red, raw flesh that looked like grounded hamburger meat. And then, the worst thing I have ever seen in my life, a humongous basal cell carcinoma that had invaded all the way through the skull. The surgery involved removing the eye and most of the upper face and skull. There was just this massive gaping hole left, and they filled it with this big flap of flesh. So, yeah, virtually nothing shocks me anymore. Good thing I have a strong stomach and the ability to keep it together under pressure. I have never fainted or vomited or gasped or anything like that. Next story. 1. Bugs on a gangrenous foot. Both times I almost lost my lunch. The worst part was that the second time I knew exactly what the faint crunching meant, but I still had to remove the socks and shoes. Then number 2, telling a highly addicted patient that I wouldn't be giving him the narcotics he wanted after he had run out of his prescribed meds early because he took too many. This was actually the only time I had ever said the F word to a patient. And I said, I'm not giving you any. I also spoke with your pain management doctor and he does not want me to fill anything for you since you made the choice to take too many of your medicines. Then the patient starts flapping his arms and legs in his bed, and I'm like, what are you doing? And he says, I'm having a seizure. That's not a seizure, that's a tantrum. Then he gets completely still, looks me straight in the eyes, and then craps his pants. And I'm actually shocked. I'm like, what the F did you do that for? And he says, well, because you're not giving me the medicine I need. Now you have to tell the nurse to come clean me up. And I'm like, yeah, nope. I will have the nurse bring you a clean gown and a towel. Bathroom's right next door, buddy. Next story. I developed a pilonidal cyst in high school that bled constantly until finally my mom forced me to a doctor. He took one look at it and said, son, I can't promise the next few months are going to be fun, but you're never going to forget them. And well, they removed my entire ass crack. All of it. Every day, my mom had to pull several ounces of gauze out of the wound to replace it, and it stuck to the raw meat as it came out. I mostly screamed obscenities into a pillow for the duration. According to the surgeon, it was the first full ass crack excision that he had had to do. There's a ton of scar tissue back there now, and I can't do sit-ups without inflaming it. To make matters worse, the first time they unpacked it, the nurse had to guide my mom through the process. Her hand went down too far and accidentally socked me in the balls. She turns to the nurse and says, "Whoops, I hit him in the balls." I asked if euthanasia was an option in our state. Next story. I once made a nurse scream, "Oh my God!" She got reprimanded even though I just laughed and I didn't mind. I had terrible pink eye in both eyes. It literally looked like I just had bright red eyeballs, worst I've ever seen. I was in my senior year of college in the middle of midterms, so I had to put off my doctor's appointment for like 2 extra days. During that time, one of my eye's mild case of pink eye spread to the other eye and went from mild to raging infection. Now my eyes are already slightly startling. My irises are yellowish green, almost like a cat. So combined with bright red eyeballs, I looked like a cat demon. I walked into the office and whipped off my sunglasses, and the nurse screamed and did the sign of the cross. My most proudest moment. Next story. There was a patient who came in, well-known history of diabetes. When I saw him, the worst of it was already over, but he still had legs like sausages and the smell in the room was like a garbage dump. There were these strange bands around his ankles that were indented to over 1 centimeter deep. Apparently, he had developed an ulcer on his foot, so instead of cleaning it and bandaging it, he decided to just put a sock over it. Eventually, the ulcer developed into gangrene and the pus began to soak through the sock. The smell became overwhelming even for him, so he decided to seek medical attention as a responsible adult would do. Just kidding, he put a plastic bag over it. Eventually, the pus seeped around the edges of the bag and started leaking again, giving rise again to the horrific smell. So now things were getting out of control, so now he decided to get it properly looked at. Got you again, though. Just kidding. He put another plastic bag over it. This process repeated about 9 to 10 times. In the ER, they had been peeling off this gigantic mass of plastic and dead tissue glued together with pus and held on with elastic bands around the ankles. That's what the indents were. It was like his foot turned into a giant pus onion with each layer swelling worse than the previous one. 2 or 3 nurses apparently threw up and they had to rotate people in to do the next layer. He wasn't even in much pain because he had long-standing neuropathy in his feet, which was why he was able to ignore the problem for so long. And that's why you always leave a note. Next story. I was working in the ER one night when a woman came in with a retained vaginal foreign body. When I went in to see her, she told me she had been having sex and the man told her that the condom slipped off. She'd tried to retrieve it, but was unable to. But she could feel that something was in there. So I grabbed a nurse, a speculum, and some forceps and took a look. There was certainly something in there. I pulled it out and it was a $20 bill. I asked her if she'd put it in there and she said she hadn't. She was clearly as confused as I was. I asked her if she wanted it and she declined. Needless to say, it went into the trash. I could never come up with an adequate explanation as to why this woman had a $20 bill in her privates, nor why her partner would have put it in there. Okay. So this is what the women do. The guys, they have their wine, their urine wine, and the women, they have their vagina money. Some ladies just put it in their bras or the pockets that they don't have or their purses, but you know what? We're dealing with freaks and weirdos, and this is what weirdo women do, and that's what weirdo men do. She pulls out the 20, he buys the wine and the catheter, and then they just have a fun time. And, you know, they both go to the hospital together. I don't know. Anyway, next story. So, my father was a plastic surgeon in the emergency room of a major southern city, so he has stories aplenty. So here is one of the worst. A family of 4 was driving on an urban highway that passes right by the hospital. The parents were in the front seats and their 2 young children, boy and girl, 3 to 5 years old, were in the back seat, apparently unrestrained by child seats or seatbelts. Coming from the opposite direction was a speeding and swerving woman driver in the throes of a psychotic episode. As the 2 cars approached from opposite directions, she swerved into the median and hit a barrier, which launched her into the air upside down. Her car, it landed on the roof of the family's car, bending the roof of the rear portion of the passenger compartment downwards and backwards in such a way that left the mother and father unscathed, but neatly sheared off the top portions of both children's heads at the brow. The accident? It happened right in front of the hospital, so in a horrified, delusional panic, the parents carried their 2 children into the emergency room, with inside of the craniums exposed and devoid of their contents. Obviously, nothing could be done. Next story. While my wife was in medical school, she helped treat a patient who was having difficulty urinating. She and the doc asked all of the preliminary questions, but they still weren't sure what the problem might be. So the docs order an x-ray. She notices a tangle of dark lines in the patient's bladder. The doctor then went in to show the patient the results as she was thoroughly stumped. After the patient sees the x-ray, he freely offers up that he likes to take baby snakes and let them slither up his urethra where they ultimately die in his bladder. His reason for doing this? Well, he said it gave him a, quote, funny feeling. Next story. So, this young female comes in complaining of acute abdominal pain and a fever. We run through all the normal procedures and come up with nothing, so we push ahead and give her a quick vaginal exam. As soon as she spread her legs, I almost threw up. No joke. I've been around some stinky folks and some smelly wounds, but this was horrendous. We wound up evacuating half the clinic because the smell of death that emanated from her vag was causing people to gag in the hallways and waiting room. Anyway, long story short, she left a tampon in, forgot it was there, shoved another one in, so she buried the first one in. The tampon sat for, we guess, at least 2 months, decaying, and then of course the area around was extremely infected. When she came to us, she was at it in the early stages of septic shock. Next story. Alright, I'm not a doctor, surprise, surprise, but this happened to me when I was in 4th grade. I noticed a small lump in the middle of my tongue and thought, oh, I must have burned it, whatever. The next morning, however, it had grown by a lot. It was freaky looking, so I told my mom. Well, she flipped out and took me to the doctor right away, near tears along with my mother in the ER, and she was not good at hiding emotions and her fright was really scary. We waited for hours as she bothered the attending nurse to no end. Finally, they called my name and brought me to a room, and it started as a normal visit until the doctor said, "I've never seen anything like that." Cue my mom crying and my heart pounding. This was an effing doctor. Growing up in a medical community, my 10-year-old brain was conditioned to think that doctors know everything. So they brought in another doctor, and another. Then they put me on a dentist-style chair with huge bright lights shining on me. Before long, there were 5 doctors and the chief of staff staring at my tongue. My mom was silent, sitting in the corner, absolutely horrified. With a huge group of doctors surrounding me, I did feel a little more comforted, but was still very scared. So, what did this brain trust of brilliant medical minds come up with? A biopsy? No. A CAT scan? No. We're gonna try and poke it. Even at 10, I was thinking, can I get a second opinion? I could not, however, talk because they were literally holding my tongue. They sprayed me with a local anesthetic that tasted like mustard, and the chief surgeon washed up, put on goggles and a mask, and he slowly moved a shining metal prod into my mouth. I could feel the pressure on my tongue. He pulled back, looked at me, and asked me possibly the grandest non sequitur I've ever heard in my entire life. When was the last time you had popcorn? And I was completely caught off guard. I said, a couple of days ago? I remembered clearly because I was trying to eat it quietly as we watched the X-Files sewer monster episode. Original airing, are you jealous? Well, anyway, the doctor sets on my chest bib a perfect half of a kernel husk. It had apparently suctioned itself to my tongue, and because tongue tissue is so quick to generate, it was essentially absorbed by my body. Lots of doctors laughing, my mom crying for joy now, and I was totally stunned. I even wound up in a big medical journal because of it. So I went to finish out the rest of the day at school and did an impromptu show and tell, which mortified most of my classmates. Then I got nauseous from the anesthetic and puked up my Cheerios in the nurse's office where my best friend was also lying down, unrelated. But all in all, it was a memorable day for me and likely the doctors as well. TLDR is, I was inspired to start a band called Dr. Popcorn Suction Fiasco. Next story. Physician here, hospital doctor for those wondering the difference. I fear this has turned into a gross-out battle rather than a diagnostic quandary, but here it goes. My most I have no idea what I'm looking at moment was the first patient I saw with McCune-Albright syndrome. I may have spelled that incorrectly. It's an extremely rare de novo mutation that affects endocrine organs, hormone-secreting organs, so you get overgrowth of many of these organs and overproduction of hormones. They also tend to be acromegalic, so like think Jaws from James Bond, but they also get large facial deformities from bone overgrowth, depending on the severity. It's a horrible condition to suffer from, but thankfully, it's rare. Then, as for the gross-out battle happening around here, as a resident in ED, I saw a youngish alcoholic female who the nurse was having a hard time passing a urinary catheter. I went to put it in, spread her legs, and a ball of bugs poured squirming out of her privates. It was poor self-care, plus lower leg venous insufficiency from child C. corrosis causing skin breakdown equals bugs. As I stood there, bent over in a state of shock, she let out a large fart which sprayed the bugs in a plume of death in my face. At that point, I just walked out to wash my soul and reconsider my career and have a coffee. You can't make this crap up. Next story. So, this one is a little different, but I worked as a tech in a mental hospital. One of my jobs was to go through and catalog a patient's belongings when they are admitted. One day, a woman came in for her third or fourth stay. She's pretty disheveled as per usual and smells pretty rough, which means going through her bag will be no fun. So I pull a pair of gloves on and I get started. Opening the bag releases the most awful smell, like something had died in the bag. So with my gloves on, and considering a second pair too, I dig in. I find normal stuff, dirty shirt that has holes in it, used tampons, coins and cash that are sticky, bits of fur. And I think, bits of fur? That's strange. And here at the bottom of the bag, as I lift it up more, I lift up some dirty pants and there it is. A dead cat. Slightly rotting. Something had died in this bag. You see, after she was kicked out of the last place that she had lived, she stuffed the cat in the bag to keep it warm and safe, and apparently forgot about it. Next story. My mother, she's been an RN in Las Vegas, Ireland, the Northern Territories, and Arizona, so she's seen a fair share of insanity. The worst story she has told me was one woman who came in due to intense cramps in her abdominal region. Upon investigation, they discovered that bugs had been eating the woman's uterus from the inside out. The only way this can really occur is through having sex with a dead body, a dead animal, or with someone who has had sex with either a dead body or a dead animal. Turns out the patient's husband, he worked in the morgue. Youch. Okay, so for some people, watching adult content is cheating when you're in a relationship. I don't want my partner watching adult content, that's cheating. For some people, they think flirting's cheating. Maybe that's too far. I don't know. That's up to you. Where are we with having sex with dead bodies? Is that cheating? It's non-consensual. Is necrophilia illegal? It is, right? I think it's legal in Louisiana, unfortunately. But, honey, what the Your husband cheated on you with a corpse! No! No, that's horrible. Next story. So, I have seen a lot of things, but one thing that really sticks out is something I saw as a medical student. I was on a general medicine rotation and was seeing an elderly lady for urinary problems. Specifically, she was having trouble holding her urine. She mentioned in passing that she had something coming out of her privates, like a mass, but she couldn't see what it was. My resident and I decided that we ought to take a look, and upon examining her pelvic region, we were unable to use a speculum to visualize the interior of her vagina because there was a firm mass protruding from her vaginal introitus. The mass was her bladder. It had prolapsed. Next story. So, my mom's an RN, and one night a dude walks into the ER holding a bag under his crotch. You see, dude got drunk with a bunch of his friends, the DD drove a pickup, and this dude and his buddies sat in the flatbed speeding down the highway. Dude, in his infinite wisdom, decided to stand up, DD eventually hit a bump, and the dude went flying and found out why they call it a split. His scrotum and taint had split and his testicles and lower GI tract had spilled out. He was carrying them in the bag. Dude was rushed to surgery and full reproductive capability was restored. Next story. Well, this must have been 7 or 8 years ago. I believe it was July or August. Nearing the end of my shift, my rooms were finally filled with low acuity crap, but there was an intubated patient in a coworker's room getting ready to be admitted to the ICU. He had an NG tube ready, but no Foley catheter, so I offered to snake him before he went down, just to keep the ICU nurses happy with us. Well, the man was on the large side and still had his sweatpants on, so I pulled one side down a little enough to see that he didn't have any underwear on, and to realize the odor was less than pleasant. Went over to the other side and pulled the pants down to mid-thigh and saw something that will haunt me for the rest of my days. The man's entire groin was covered in a thick crop of genital warts, and the odor was coming from a red, moist, nasty yeast infection under his chicken and between his legs. Normally, it is only a nice thick lung butter that can trigger my gag reflex, but this crop of warts was doing me in. I gathered my Foley catheter equipment, set it up between his legs, and got ready. And have you ever noticed that sterile kits designed for physicians have nice elastic sterile gloves in them, while nursing kits have crappy little stiff vinyl gloves? Well, I ripped the palm out of one of them while putting them on, and there was no way I was touching that crop with any chance of having it touch my skin. So I figured this was a sign that I needed to go show the doctor this mound of warts. So I went to the doctor's station and I said, "Hey doc, I promise I won't say this to you very often, but you really need to come check out this guy's wiener." And there was a look of curiosity and excitement mixed with a little bit of fear on his face. We went into the room and the doctor had a slight smile as I pulled up the sheet that was covering the man's junk. That smile quickly vanished, followed by a brief look of confusion. Then his skin turned pale and his face dropped. His hands went up into a defensive posture, and he quickly left the room, mumbling something about, "I hate you. I really didn't need to see that. You will pay with enema duty for years to come as a punishment." And I laughed for a short time, but then I realized I still needed to stick a catheter into that mess. Got a new pair of sterile gloves, extra long, and I went in. Crabbed the wart-covered chicken with disgust as the other nurse was preparing the monitor to go with the patient to the ICU. I could tell he was trying not to watch, but just like a bus crash, he couldn't pull his eyes off as I lifted the wiener up, revealing what used to be a scrotum, but now was nothing more than a collection of warts on top of warts. I held it up as I prepared to clean the tip with iodine swabs, and I couldn't help but say, "Textured for her pleasure." This was all the other nurse could take, and I was left alone to finish the folly. I cleaned the tip 3 times and attempted to put the folly between the 2 warts on the tip, but it wouldn't go in. I started to look around a little to see what the problem was when I realized the distal part of his wiener was not the top of his wiener, but just a mass of warts that had grown up and over the shaft. The tip of it was underneath my thumb, as if it had a hypospadia. And I hadn't cleaned that area, so I got more iodine and fresher gloves, cleaned the warty ventral side of his wiener, and stuck the Foley catheter in. Thankfully, it went in without problems and I got a good urine return. Reported off to the primary nurse that the folly was in, did my charting, and lapsed into a catatonic state because of the horrors I had just seen. The next morning, I came into the patient's room where he was recovering to check up on him. I asked him if he needed anything, and he looked up at me and said, "I'm gonna need about $350." Well, it was around this time I realized that our patient was 8 stories tall and a crustacean from the Paleolithic era. It stood above me with its big red eyes, and that damn Loch Ness monster had got me again. "Damn it, monster, I ain't giving you no $350, damn Loch Ness monster," I screamed. It's pretty difficult to recover from something like that, and we discharged him immediately. Next story. ICU doctor in a major trauma center here with years of experience. Let's see. Group of intoxicated teens driving around town. One passenger in the back opens the window and projects his upper body out of the car while other people hold his belt. Stoned drunk driver sees this and decides to scare his friend by passing close to a street sign. Moments later, people kick in the ER doors screaming. I jump there, they grab my coat and drag me to the car. We're a body without a head and most of the armrests hanging out the window. Freaked out dude tries to give me the head while screaming, "Do something!" There was another time where a drunk girl was riding a motorcycle, forgets the helmet in the bar, and decides to turn the wrong way in a one-way street. Hits car, flies headfirst into a street pole, massive brain injury, making cerebral tissue swell, which would be the cause of a rather early death. But she was saved by neurosurgery and a basal skull fracture, making her brain insulate out to the nose and helping relieve pressure inside of the skull. Huge amounts of brain tissue came out of her nose for days, and the nurses did a great job in wiping it constantly, so the family never had to see it. She survived with major sequela. Then there was the dude riding his motorcycle who hits another motorcycle, almost loses his leg, discharged from the ICU very well with a shaft inside his femur to help it heal. Well, goes berserk the day after and discharges himself from the hospital. A week later, he was readmitted, the leg swollen red and copious amounts of green pus oozing from the surgical incision. He lost the leg, but he survived. And finally, strange dude gets his ball sack pierced multiple times at home by himself. Ballsack got infected, his nuts were floating in pus, the infection had spread to the abdomen and fascia on admittance, causing necroticizing fasciitis. Just an awful smell, lots of surgical removal of infected tissue, including testes, wiener, rectum, bladder, all in vain. Next story. Worst in the last 24 hours, patient after colon surgery returned to ER with a wound infection. I took out a few staples to drain the fluid, but instead, about 100 milliliters of feces burst out all over the bed, patient gown, etc. Patient had a fistula to the bowel. Then the worst ever, went to see a patient with an ingrown toenail. It was just hanging on by a thread, so I froze the toe and pulled the nail off. Well, there were bugs living under the nail, like a lot of them, but you get used to this stuff. The fistula was surprising, but I'm beyond being grossed out by it. However, the bugs really caught me off guard. Next story. Early on in my career, we took a call for an unconscious, unresponsive female. We get on scene and fire is already there. They're in full bunker gear with SCBAs. We could smell it from outside. This lady had a colostomy and developed C. diff. She rolled out of bed and the bag tore out. She laid in an ever-growing puddle of her own crap for 2 days before someone found her. The sores she had were so infected, the smell was awful. We had to drag her outside and spray her off with a water hose before transport. That ambulance was out of service for a week being deconned. Next story. Okay, not a doctor, but when I was a paramedic student, we used to do rotations in the ED. A guy was brought in from what I assume must have been a horrendous nursing home. He looked fine at first, but once they took his pants off, the issue became apparent. His testicles were about the size of a football and necrotic. It's called Fournier gangrene. He must have had it for quite some time as well, judging by the size, color, and smell. He had a stroke in the past and was now much less alert than his normal self. It looked painful, but the worst part was the smell. It smelled like rotten crab meat. One of the residents that came in to evaluate him looked as if he was going to vomit and left the room within 20 seconds. I felt terrible for the guy. He had no clue what was going on, and he clearly must have become used to the smell. When I went home that night, my roommates and friends decided to make appetizers, and one of them brought mini crab cakes. The smell gave me an image of that guy's testicles immediately, and it was the cruelest irony that I could ever think of. Next story. This happened to me today. My post is emergency department specifically for internal medicine. In our hospital, it is a normal protocol to transfer patients to different services, like transferring surgical patient to orthopedic service, because the trauma is localized to the limbs alone and can be managed by more orthopedic surgeons. Well, there is one patient that is to be transferred to us from surgical service. All we knew is that he needs to be managed first by medicine because his hemoglobin is too low before undergoing tumor debridement. My partner was assigned originally to interview this patient before the official transfer, but he pestered me enough to accompany him. All he said was to prepare my nose and that this patient was just taken in by a good Samaritan from the streets. I, as a previous nurse, am used to all kinds of smells before, so it was no biggie for me. And as we were approaching the patient, I can already smell him. The smell is a mix of urine, unshowered person, and diabetic foot. When you encounter diabetic foot, you'll never forget diabetic foot. But the patient was on his side, nubs for lower extremities, and missing some digits on his upper extremities. No diabetic foot, but I noted some gauze at the back of his head. I figured that maybe that was the source of the smell. I did not investigate further at that point, though. He was also not well groomed. We approached the patient from his front so as to not startle him. As my partner was interviewing him, though, he was still responding to some questions. Most of the time, he was just staring off into space, and I kept my distance because I was afraid that after his blank stare spells, he'll scream and grab at us. Anyway, as my partner was distracting him with questions, I decided it was the best time to inspect his wound. As I was going around the patient, I saw the head wound from afar. I thought that it would just be a gaping tumor, but what I saw would raise my hair every time I would recall it. At the back of his head, you would really appreciate the significant loss of tissue and bone eaten by the tumor. You would even think that he lost his occipital area altogether, but that's not all that's eating him. Lots of bugs were swarming the tumor area, most specifically the periphery. The wound was moving a lot that you really couldn't take your eyes off the whole thing. After seeing that wound, I noped out of there. Well, everybody, we have made it to the end of the slightly gross video. Just bugs, lots of bugs today, but also not the first time I've heard about just bugs getting into people. And oh my God, and the cat story too with the fat lady. And I won't even mention the urine in the wine. Do you remember that? And the 20 and the hoo-ha? This was an insane one, and I'm sure I mispronounced some words, but medical videos can be my kryptonite sometimes, but I thought I did a decent job, and sometimes they just don't make the stories in layman terms, but I understood most of these, so I'm happy. And also, I've got a really wild conspiracy theory for you guys. Don't tell anyone, but I think hospitals are secretly run by the doctors. Don't tell anyone I said that, but I don't know how to prove it, but I feel like it might be true. Just my conspiracy theory for the day. But anyway, guys, we're at the end of the video. Thank you all so much for watching, commenting, and have a good one. Bye!